My name is Dr. Teresia Wangari Kang'ethe. I am a dentist by profession with a special interest in pediatric dentistry and orthodontics. I am the owner and the practicing dentist at Smiles and Grins. It's a dental private practice on Kiambu Road at Feruzi Towers. Today, in partnership with Ponea Health, we're going to talk about dental caries. We recommend that you visit your dentist every 6 months. Now, in those 6 months, when you go for your checkup, there'll be several things that your dentist is looking at. One, they'll be looking at, do you have any cavities? Do you have any new cavities if it's a follow-up appointment? We're also looking at how are your gums? Are you being able to clean around your gum line? Is there something we need to do about that? And in those follow-up appointments, your dentist will also do some x-rays. Usually they're looking at in-between teeth. We know that cavities in between teeth are not discernible just by looking at them unless they're really, really big. So they'll do checkups and see whether they'll do x-rays just to confirm whether you have any new cavities forming in between the teeth, any new caries in those areas, and they'll either do cleaning for you, do any fillings you require, but every 6 months, visit your dentist. The rest of the treatment will be done on a need-to basis. Treatment options for dental caries usually depend on the degree of which your tooth has been damaged by the dental caries. For example, say you have a small cavity forming on a pit. The pits are usually those valleys that you see on your back teeth. Say there's a small cavity forming there that is not progressed, that can be easily cleaned out using the manual instruments that we have. We usually clean out that pit only, and we do something we call a preventive resin restoration, where you just clean out those pits and cover them with a flowable material just to make sure the cavity does not continue growing. Once you have a cavity that is already beyond just the outer layer, the enamel, it's gone into the dentine, usually your treatment option is to have a filling done in that area. Nowadays, we no longer do the metallic fillings. We only do the aesthetic tooth-colored ones. So I know that was a major fear for most patients before, but we do the aesthetic fillings now. Once we've gone beyond those 2 layers, and now we've gone to an area where your nerve space is also affected. This could be, you would know that the nerve space is affected by either having some pain, having some swelling next to that tooth, or things like that. Usually in such a case, we have no option but to do what we consider a root canal treatment, followed by a filling either in that space, or if the damage on that tooth is a bit extensive, we do what we call a caul buildup, then we put a crown on that tooth. The caries process is not one that is able to stop on its own. So if left untreated, you usually will get just a more advanced form of the caries process. You at first will have sensitive teeth, then you'll have painful teeth that will not let you sleep at night. After you have the painful teeth, even your nerve space will actually die out. At that point, you start seeing infections or some swellings next to the teeth on the outside or the inside of the jaw. If still left untreated, you can actually get facial swellings either in the area of the cheek, the face, around the eye. You can also have swellings under your lower jaw if it's a lower tooth that is affected. There is a complication that can be potentially life-threatening, what we call the Ludwig's angina. This is where you have an infection on a tooth on the lower jaw that has gone to spread into the space underneath your lower jaw. We call that the submandibular space. Once it has been left untreated again, can spread to the other side. And what usually that leads to is a blockage of your airway. And in such a case, it becomes a life-threatening medical emergency. So that's the worst case scenario. It doesn't happen often. It's a bit of a rare occurrence, but any carious tooth that you have, just have it treated. The nature of teeth is in such a way that the second layer, what we consider the dentine, is very, very sensitive. And because of that, anytime we're doing a filling on your tooth, we will have to numb you first. Otherwise, it can be quite a painful process. A properly done filling should have no pain afterwards. A bit of sensitivity for the first few days, but it should have no pain afterwards. Instances where sometimes maybe we miss the fact that your nerve was a little bit affected, then you could have some pain, indicating that what you really require at that point is a root canal treatment. But generally, a filling should not hurt after it's already done. Now, most fillings are covered by your dental insurance, that they do. A thing to note though is a filling can never be as smooth as your natural tooth was. Because of that, there is a very big tendency to get decay around the fillings that have been done. So one of the things you need to do is anytime you have a filling, if it's in between teeth, make sure you're flossing your teeth. If it's just on the surface, make sure you're brushing and your oral hygiene is very good. As to the lifespan of a filling, that is usually a very difficult question to answer. But generally speaking, roughly about 5 to 10 years, your filling should take you about 5 to 10 years, after which it will need to be replaced. Now, that's generally why we also avoid doing unnecessary fillings, because anywhere where you've done a filling, you'll probably need to do it again within the lifespan of the person who's having it done. We do know, though, that the original fillings that used to be done, the metallic ones, they used to last very, very long. It's only that there are concerns about mercury, so we're not able to use them as much nowadays, but those ones can last for very many years. Thank you for joining us in this discussion. You can book our services at ponea.com. We look forward to engaging with you more in our coming episodes.